today. The objectives of the lecture to define the obesity, to talk about causes, complications, types of obesity, clinical assessment, and lastly, medical and surgical management. To define obesity, it is a condition characterized by an excess body fat with a body mass index of more than 30 kg per meter square of the surface area of the body. This results from imbalance between the amount of energy consumed in the diet and the amount of energy expended through exercise and bodily functions. You remember in the previous lecture, we talked about the energy balance. And we say that what we take from energy should be expanded to keep our body weight constant. If the intake is increased and the expenditure decrease, then the obesity will develop. Why the obesity is important? Really, it is not just a state of body weight. It is a syndrome because it will cause complications involving almost all body systems. So it will affect the endocrine system in the first part, and it will cause an insulin resistance with impaired fasting glucose and glucose intolerance. Later on, the patient will develop type 2 diabetes. Also, it will affect puberty, and it may cause menstrual irregularity in female. Also, there is a syndrome called polycystic ovary syndrome in female, also contributed to excess body weight. In addition to that, the obese persons are more susceptible to get hormone-related cancers, especially breast cancer, endometrial cancer, and prostate cancer in male. The other important system affected by obesity is the cardiovascular system. It is associated with the metabolic syndrome, leading to the hypertension, dyslipidemia, in addition to the diabetes that we described. And all of this will lead to a state of coagulopathy and endothelial dysfunction, so it is leading later on to coronary heart disease. The GIT complications. Obese persons are more liable to form gallstones. Also, they are more prone to have the syndrome of gastroesophageal reflux. So always they complain of acidity, especially after meal. There is another important GIT complication called the non-alcoholic fatty liver disease, NAFL مختصاره. This non-alcoholic fatty liver disease is really critical because if it is not diagnosed and treated properly by reducing weight rapidly, it will end later by a chronic liver disease. Also, obese persons are more liable to develop colon cancers. Regarding respiratory complication of obesity, most of them they have exercise intolerance and obstructive sleep apnea. As you know, the obstructive sleep apnea is now also leading cause for many diseases, including hypertension, including pulmonary hypertension also, and right side heart disease. Also, they are more prone to develop asthma. Renal complication of obesity, including a state of glomerulosclerosis, and also they are more liable to develop renal cancer. In addition to that, it is very well known that obese persons, they are more prone to musculoskeletal problems. So they are liable to get ankle sprains, flat foot, and also they are liable to develop osteoarthritis and chronic backache. Regarding the neurological complication of obesity, there is a state called benign intracranial hypertension, idiopathic or benign intracranial hypertension. That's to say there is increased intracranial pressure in obese persons without presence of underlying brain lesion. So it will cause chronic headache and dizziness. Skin complication also well known. They are liable to get a skin infection, especially in the groins and submammary area because of area of sweating. So also they are liable to get candidiasis. Also, they are liable to develop the varicose veins, الدوالي, because of their heavy body weight. All of this added to the psychological complaint of obese person they have eating disorder. Some of them, they go to bulimia. Also, they will have some bad social relations, poor self-assessment, and even depression. It is important here to talk about types of obesity. So regarding body fat distribution is also important. The distribution rather than the amount of excess adipose tissue is the important thing. Really, we have two patterns of obesity. The first pattern, which is called the central obesity, or also have the name of apple-shaped obesity, also called android obesity because it is more common in male, and it is male type of obesity. This is really due to increased intra-abdominal fat, and this is the dangerous form of obesity. فإذا إذا سمعنا central obesity أو abdominal obesity أو visceral obesity أو android obesity or apple-shaped obesity نقصد بها نفس الشيء واللي هي central type اللي more risky, and it is more common in male, and it is also more closely associated with type 2 diabetes and metabolic syndrome and cardiovascular risk. فإذا central obesity نقصد هي الكرش، يعني تشوف أطرافه نحيفة لكن عنده كرش. فهذا central abdominal obesity really is the dangerous form of obesity, and it is the leading for different liver accumulation of fat and different metabolic syndrome complications. The other form of obesity called subcutaneous fat accumulation, and it is called generalized or gynoid because related more in female, or pear-shaped obesity. فهاي الأوبستي تكون mainly بالأطراف أو بالبوتكس، لكن البطن والكرش يكون قليل بالحالة، and it is less risky to develop the complication of obesity. هذه especially seen in female before menopause. After menopause, usually the obese ladies will get the same appearance of the apple-shaped obesity like in men. As we say, the fat deposition within specific organs, especially the liver, is important cause for metabolic risk in obese person, and it is more common in the central type or apple-shaped obesity. What is the etiology of obesity? The accumulation of fat will result from discrepancy between energy consumption and energy expenditure, as we say. That's too large to be defended by the hypothalamic regulation of basal metabolic rate. ذكرون بالمحاضرة السابقة حكينا على البالانس, and it is usually regulated by special hormones secreted from the stomach, the ghrelin and the leptin, which is secreted from the adipose tissue. And we tell you that the leptin, which is secreted from adipose tissue, whenever the adipose tissue increases, the leptin will increase, and it have an suppressive stimulant for the hypothalamus to stop more eating. Like sometimes in severe obesity, this process of defense against obesity is felt, and the patient will continue to gain weight even with increasing his adipose tissue. It is known that continuous small daily positive energy balance of only about 50 to 200 kilocalorie per day will lead to a weight gain of 2 to 20 kilogram over 4 to 10 years. So if some person eats excess calorie of only 200 kilocalories per day, after let's say 10 years, he will develop 20 kilogram increase in his body weight. Also, another fact that body fat content shows tracking with age, so that obese children usually when they grow up, they will be obese adults. And also we should know that the weight tends to increase throughout adult life. So when you get older, your body weight will increase. That's because the activity is decreased and basal metabolic rate will become slower. So we have some causes increase the risk of obesity nowadays in most of the world, and these including either increase energy intake or decrease energy expenditure. The environmental situation of increasing energy intake, because there is increased portion sizes. يعني قبل كان ممكن حتى الإناء اللي يتناول بينه الطعام كان أصغر حجما من حاليا اللي يتناولون أطعمة بينه. Also increase snack and loss of regular meals. شوف دائما المطاعم موجودة متوفرة في أي وقت ممكن يدخل المطعم وياكل. also أو بالبيت يجيب أنواع مختلفة من الأطعمة، وأيضا ممكن يشتهي ياكلها حتى بدون أن يكون جوعان. طبعا زيد البادي ويت. in addition increase energy dense food اللي هي الفاست فود المعروفة اللي تكون delicious ويتقبلوها الناس، لكن it is very harmful because ممكن إنه وجبة واحدة من الفاست فود ممكن تحتوي على ما يحتاجه الشخص خلال 24 ساعة كاملة. and increase in the affluence يعني increase الثراء. الأثرياء دائما العزائم والأكل مالهم يكون متنوع وكثير أكثر من حاجتهم. ف this also will increase the energy intake and lead to obesity. The decreasing energy expenditure in the other hand, especially all of us now using car, so the ownership of car is increasing. There's this walking to the school or work. يمكن احنا في وقتنا نتمشى الى المدارس، هسه ما بقى هذا الشيء، ماكو طفل او شاب بالمدرسه او بالكليه ما عنده اشتراك. Also increased automation يعني everything now is automatic. الدرج صار متحرك والمصاعد موجوده، فقلت الحركه الى درجه كبيره. Decrease sports in schools. بالمدارس معظم حصص الرياضه تحولت الى حصص للرياضيات او للفيزياء، وقل الاهتمام بالرياضه عن قبل. Also more time we are spent on the computers and on watching TV. فهاي new lifestyles كلها changing our good habits to bad habits. We are more long sitting, more long less moving. And also the central heating is available everywhere. As we say, the heat usually the cold will expand more energy, but when heat weather usually expand less energy. In addition to that, there is some genetic susceptibility to obesity. There is some polygenic disorders which account for less than 5% of variation in body weight. يعني بعض العوائل تلاحظون إنه all of them are obese. جزء منه due to their habit of eating, وجزء منه due really to some polygenetic disorders they have. There is a few rare single gene disorders also identified would lead to severe childhood obesity. يتذكرون بعض الصور أحيانا يطلعوها بالفيسبوك أو بالتلفاز يشوفون there is obese boys or girls in young age, morbid obesity, very obese, and this is really some rare genetic single gene disorders they have. Also, there are some diseases which considered to be reversible causes of obesity. That is to say, if you treat these diseases or provide certain drugs, you might stop weight gaining and return to normal weight. Especially the endocrine factors, so hypothyroidism may cause obesity, Cushing syndrome will cause obesity, insulinoma, that's increase in insulin secretion, make patient always hunger and search for eating, and also some hypothalamic disease like tumors or injury. There are also some groups of drugs will increase appetite and decrease weight, especially the antipsychotic drugs, the new antipsychotic drugs, also sulfonylurea and thiazolidinide اللي هي تستعمل treatment of diabetes and the insulin as well. كلها زي can cause hypoglycemia and increase the feeling of hunger. Benzocaine اللي هو anti-migraine, also steroid therapy in general, and also sodium valproate اللي هو anti-epileptic, and the beta blockers also can cause obesity. How we are going to assess and investigate a patient with obesity? Our aim is first of all to quantify the problem, to know for which degree he is obese, and exclude any underlying cause. Try to search for a treatable condition, for example, like hypothyroidism or Cushing syndrome, and then identify the complication. So we need to know if the patient, our obese patient, gets diabetes, get hypertension because of obesity, and then we will reach to the management plan to decide whether to continue lifestyle changes or medication or even surgery. How we are going to quantify obesity? The severity of obesity can be quantified by four types of methods. First, by measuring body mass index. Second, by measuring waist circumference. Then measuring triceps skin fold thickness. And the DEXA اللي هو dual X-ray absorptiometry اللي هو معروف أيضا بالفحوص الأوستيوباروسيس يستخدم ويعطينا أيضا فكرة عن ال body mass index of the patient. The body mass index usually is taken just by بمعادلة بسيطة تساوي الويت بالكيلوغرام over the height in meter square. The problem of the body mass index, it cannot discriminate between lean body or muscle mass and fat mass. And there is variability of fat mass distribution according to ethnic groups. So to know, this is very important table, I want you to concentrate on it because it will quantify obesity according to body mass index. The ideal normal range will be 18.5 إلى 24.9 kilogram per meter square. هذا يعتبر reference normal range. And if your body weight is within this range, then the risk of obesity will be negligible. The risk of complications, or comorbidity of obesity will be negligible. When the body weight starts to increase above 25 and above kilogram per meter square, then we enter to the overweight. And here, the risk of comorbidity of obesity will start to increase. فمن 25 إلى حد 29.9 يعتبر overweight. من يصل 30 دخل بالobesity. So any 30 kilogram per meter square of body mass index indicate obesity. And here, the risk of comorbidity will start to increase. من 30 إلى 34.9, still he is in class 1 and considered as moderately obese. If the obesity increased and the body mass index reached 35 up to 39.9, then it is considered as severe obesity. And if it is more than 40 kilogram per meter square, it is a class 3 and considered very severe, or also called morbid obesity. The waist circumference also important because we just a few slides ago we talked about the central obesity. فإذا waist circumference راح يفيدنا إنه نعرف هل patient have central obesity or just a gynecoid type. So the risk of metabolic and cardiovascular complications of obesity is higher in those with a high waist circumference because هذول يعكسون central obesity type. In men لازم ما يتجاوز waist circumference of 102 centimeter, and in women ما يتجاوز 88 centimeter. When it is more, so it is the cardiovascular risk will start to increase. The other important thing to do is, as we say, to exclude the underlying cause. So we need to take a detailed history from the patient. I need to discuss with him the dietary history. There is some pathological eating pattern, for example, binge eating اللي هو الشراهة في الأكل, and also nocturnal eating اللي هي المريض بالليل يبقى سهران ويبدأ يدور الأكل بالليل, فبالنهار يكون أكله طبيعي, بالليل يبدأ يزيد energy intake by taking an extra meal not needed to the body. Or also bulimia, which is a different other behavior that the patient used to eat a lot and try to induce vomiting to get rid of the overeating thing, and it is really a pathological problem. والpatient راح يتراوح بين obesity وبين الأنوركسيا, ينزل الوزن وأحيانا يزيد إلى درجة غير مقبولة. Also, we need to ask about any history of alcohol consumption because, as you know, learned in the previous slides, that alcohol contains large amount of energy. Also, it is very high in energy, and the patient not eat. Sometimes they only depend on the alcohol, and also it may cause obesity. Also, we need to ask about the history of the weight gain itself. Is it recently gained weight, or it is accumulated slowly over years? And if it is fast, then we need to know if there is underlying pathological problem lead to this acute change in their body weight. And also we need to ask if the patient taking any drugs. As we discussed previously, some drugs may cause obesity, like antidepressant or beta blockers or other treatment for diabetes. And as we say, also to search for any underlying cause leading them to change rapidly and they will gain rapidly body weight, especially hypothyroid and Cushing syndrome. To exclude these secondary causes for obesity, we need to do some lab tests. So all obese patients, they need to have thyroid function test and also what's called overnight dexamethasone suppression test to diagnose Cushing syndrome, or we can also do the 24-hour urine-free cortisol to diagnose the Cushing syndrome. Some monogenic and syndromic causes of obesity are usually only relevant in children and presenting with severe obesity, وعادة المريض هذا يروح للبيدياتريك وممكن نعمل some gene study to know why he is different from other children. So after we are diagnosed that our patient is obesity and we know the grade of his obesity, and also we take a good history and try to exclude underlying causes. Then I want to assess the complication of the obesity. As we remember in the previous slide, all the systems of the body are prone to develop the complication. So we have a very important test to be done, especially to assess the cardiovascular risk, to do ECG, to do echo study, to measure his blood pressure, and remember that we may need a large cuff to measure the blood pressure because a small cuff will give us a false low reading. Type 2 diabetes should be also checked for by doing fasting sugar or glycated hemoglobin sugar اللي هو ال HbA1c راح تاخذوه بعدين من تدرسون diabetes, and to check for their lipid profile and to assess if there is hyperlipidemia. Some patients, as we say, that their fat will be deposited in the liver and causing the fatty liver disease. So this will lead to elevated transaminase liver enzyme, and we should also pay attention that this patient needs urgent therapy, not to go fastly to the liver cirrhosis. And we need to discuss with the patient how the obesity affecting his study or affecting his work or is affecting his social relations. And this is because the psychological part of treatment is also very important. So the management of obesity, sometimes we need to have rapid or short-term interventions in those patients who have high health risk, for example, and comorbidity associated with their obesity. For example, مريض عنده acute joint problem or عنده uncontrolled diabetes and he is very obese, then we should act shortly and within a short time to remove his excess body weight. And also some patients, they already have their wills to and capacity to change their lifestyle to achieve weight loss. So also those patients need to pay attention and to help them to reduce their body weight. The first step in treating obesity is lifestyle advice. So behavioral modification is needed. First, we should advise to increase their physical activity by doing some exercise. For example, walking is very important, which is the best thing is to do in obese persons. If the patient cannot walk because of, as we say, associated joint problem, then encourage swimming, maybe alternative to walking, and other maybe more they can go to gym and to start more different types of exercise. Also, we should advise them to change their eating behavior. They should start to select food. They should start to have small size portions and avoid taking a snack and try to take regular small meals and avoid satiety, because sometimes if they will not take a large meal at time, they will get more hunger and may eat double in the next meal time. And try to decrease sugar intake, and it may be even substituted by artificial sweeteners. All of this behavior and lifestyle advices and eating advices should be also supported by some dietitian. They can go to weight loss centers and they may meet other groups of the same problem and they can help each other. So it is important also to have support by some dietitian or by a group management. The weight loss diet, really, it is recommended that reduction of daily total energy intake should be from normal consumption should be within 600 kilocalorie. لا تكون أزيد من 600 kilocalorie reduction of their usual intake. Then later on we can decrease more. بعد ما المريض يتعلم على نوع معين من الفود اللي قللنا الكيلوكالوري، بعد فترة ممكن ننصحه إنه يقلل جزء آخر من الكيلوكالوري, but not to start more than 600 per day. And also the recommended weight loss is to be half kilogram per week. يعني بالشهر 2 kilograms تقريبا. لا يكون كلش رابيد. بعض المناهج الدايت تنزل الوزن بطريقة سريعة كيلوين بالأسبوع, which is really very fast and it may be dangerous to the patient. فالrecommended هو slow lose will maintain this body weight better than rapid lose, which will return also rapidly. We need to also to remember that vitamin supplementation may be needed, especially the patient in strong dieting programs, and not to decrease our protein intake to less than 50 gram in male and 40 gram for female. So whatever type of diet we do, it should contain 50 gram of protein for male and 40 gram of protein for female. The energy content also should not be less than 400 kilocalorie for women or 500 kilocalorie for men. The side effect of dieting, by food control, will be either orthostatic hypotension, or headache, or diarrhea and nausea. The starvation really is not recommended because it will cause severe loss of the muscle mass. The patient will go to starvation state and he became skin and bone. So we need to avoid the dieting that cause loss of muscle bulk. We should remember that rapid weight loss and severe dieting programs may lead to development of arrhythmia and even sudden death. Especially هذول اللي يخلوهم على الكيتوتيك diet for a long time ممكن إنه patient have sudden death أو يصير عنده arrhythmia أو يصير عنده electrolyte disturbances. The low calorie diet therapy for obesity. عندنا many types of low calorie diet. إذا تشوفون هذا الجدول أمامكم. The normal diet should be containing 50% of carbohydrate. Our energy will be in form of 50% depending on carbohydrate, 30% depending on fat, and 15% depending on protein. The first change of diet maybe we can depend on the moderate fat intake. That's to say, increase the carbohydrate energy source to 60% and decrease the fat to 25% and keep a protein 15%. Or there's what's called low carb diet اللي هو قريب من الكيتوتيك diet. راح يقلل الكربوهيدرات to only 10% source of energy ويزيد الفات diet up to 60% of energy وأيضا يزيد البروتين up to 30% of energy. The other type of dieting, they depend on what's called high protein diet. In this case, the carbohydrate will be little bit decreased and the fat will be still high and also protein will be high. And the other type of diet is low fat diet. يزيد الكربوهيدرات ويقلل الفات percentage of dieting. طبعا different types of diet كل واحد لها دعايات خاصة بها. The patient should choose the thing that he can tolerate and can perform. Still, there is a role of drugs to be used to treat obesity. Many types of drugs was used before, and most of them are stopped because of critical side effects, especially pulmonary hypertension caused by some drugs. Amphetamine can be used قبل addiction of drugs. So really now only 4 drugs or a drug combination recently been approved in the USA. في أمريكا في بعض الدول الأوروبية not all approved. Sorry. Always we should remember that drug therapy should also used in adjacent to the lifestyle advices and support. Not alone just to give a drug and go tell patient to go without changing their lifestyle and also supporting by other قلنا dietitian and group treatment. The first drug الحقيقة هذا موجود وريسنت وموجود في العراق أيضا موجود اللي هو not that very recent الحقيقة يمكن أقدم واحد حاليا عندنا بالعراق اللي هو الأورليستات اللي هو الأونلي فت الاسم الثاني اللي قد تنتجه الحكمة. الأورليستات هو drugs that sorry معي طلاب تسمعوني ولا صار قطع بالنت؟
معك يا دكتور.
اوكي. فاذا قنتكلم عن الدراج ثيرابي قنتكلم عن الاورليستات قلنا هو الدراج موجود وافيلبل موجود في العراق ايضا. This orlistat will inhibit pancreatic and gastric lipase. So this will reduce dietary fat absorption by تقريبا 30% of diet. فإذا هذا الدواء يشتغل فقط إذا with meal. That's to say if you consume a meal containing fat راح يقلل absorption of this fat in your diet or in your meal by 30%. So it will induce a state of malabsorption of fat. فكأنما قد نعمل المريض كأنما قد نعمل malabsorption of fat. The problem of this drug is it will not be absorbed as we say, and adverse side effects will be related to the effect of the fat malabsorption اللي تصير عنده. So the patient usually they have loose stool تكون تشبه الاستياتورية. إذا كنت تتذكرون كنا أخذتها بالاستياتورية، يشبه الاستياتورية ستول، يكون fatty, oily, pale color, and also sometimes they have oil spotting, urgency and incontinence, even of fecal urgency, flatus, abdominal distension will be there, and sometimes they will have malabsorption of some fat soluble vitamins إذا تذكرون شرحناها المحاضرة اللي فاتت مثل الفيتامين D or vitamin A or vitamin K. So we should pay attention in this patient not to have fat soluble vitamin deficiency. This early stat usually taken, as we say, with each meal, and dose here from 60 to 120 milligram can be taken, and try to decrease the dose to avoid or decrease the side effects. The other drug هو combination الحقيقة of low dose of phentermine اللي هو appetite suppressor and topiramate اللي هو أيضا يستخدم كأنتي-epileptic drug. So a combination of these in form of extended release tablets is approved to use in USA, but not approved to use in Europe. This will result in weight loss of approximately 6% of greater than placebo, and it will also, by decreasing this 6% of body weight, may help to regulate lipids and glucose concentration. The side effect of this combination mainly is teratogenic effect, so it shouldn't be taken by women in childbearing ages, or the patient should be advised not to get pregnant if she is taken it. Also, the phentermine may have some cardiovascular effects. It may cause tachycardia, hypertension, and if the patient have cardiac disease, should not be given. The other new drug الحقيقة الدواء اللي بتتكلم عنه هو الجديد اللي جاي حاليا، يمكن بالموصل بدأ وصل بالشمال، موجود في بغداد أعتقد أيضا موجود، اللي هو الليراغلوتايد. الليراغلوتايد اللي هو الاسم الآخر مالته ساكسندا، استخدم أيضا هو استخدم لعلاج الدايابيتس باي انجكشن، ينعطي على شكل انجكشن، واستخدمونه بلور دوز لعلاج الدايابيتس، سو انتي دايابيتيك دراج هو. فالسمول دوز مالته اللي هي 1.8 ملغ يستخدم لعلاج الدايابيتس واسمه فيكتوزا. نفس الدواء أيضا هو عبارة عن بين قلم يستخدم يشبه قلم الانسولين. أنتجوا فورمة أخرى منه هي لارجر دوز اللي تعطي up to 3 ملغ. هذه هي اسم الساكسنت، الاسم العلمي مال التجاري العفو. هذه استعملت لعلاج الأوبيس بيرسون even if they are not diabetic. فممكن إعطاء حتى لو كان مريض غير مصاب بالسكر، ممكن إعطاء لعلاج الأوبيسيتي. So higher dose of the injectable liraglutide اللي هو يشتغل as GLP-1 receptor agonist، اللي هو يسمونه the glucagon like peptide 1 receptor agonist. هذا effect of this drug, it will increase the insulin level, and also it will decrease the glucagon level. فيزيد الانسولين ويقلل الجلوكاجون level، وهذا كان يستعمل لعلاج الدايابيتس. وأيضا شافوا إنه يقلل الأبيتايت and it will control the weight of the patient who are obese and even non-diabetic. It is approved for use, even in Iraq it can be used now, and in Europe and in USA. It is reducing the risk of diabetes also in patients who are pre-diabetic. الأذر دراج اللي موجود يمكن في ديفيدسون، الحقيقة لما حضرنا المحاضرات من ديفيدسون كان موجود بهالطريقة إلى حد العام اللي فات كنا نحكي عنه، اللي هو مستخدم أيضا في أمريكا، اللي هي اللور كاسرين. هذا الدواء كان approved باليو اس اي، لكن last update للأدوية شفنا إنه it is withdrawn now in 220 because of carcinogenic effect. So قبل كانوا يقولون safe, but now we can say it may cause carcinogenic effect, and even from USA it is withdrawn. So هذا الدواء ما الأفضل عدم استعماله وسحب من الأسواق. يبقى last آخر الدواء الكي اللي هي السيرجري. السيرجري كلها اللي to decrease body weight اسمها bariatric surgery، نسميها bariatric surgery، نقصد بها هي different types of surgery to reduce weight. It is the most effective long-term treatment for obesity. يعني أحسن طريقة. معظم اللايف ستايل والدايت كنترول معظمها ترجع الوزن خلال فترة سنتين أو 3 أو حتى 4 سنوات، ترجع الوزن مرة ثانية. لكن هذا it is the most effective long-term treatment for obesity is to do the bariatric surgery. It is the only anti-obesity intervention that reduce mortality. فيقلل mortality related to the obesity. But we should pay attention that it should be complemented only on motivated patient اللي يريد يعمله. And also if they have a very high risk or complication of obesity, and if they are on diet and drug therapy and all is fail. فإذا ما لكل مريض تجرى المريض اللي want to do it and who have already on lifestyle change and diet and not reduce weight, and those who have comorbidity with their obesity, especially diabetes. فهي ستدخلت حتى كعلاج للديابيتس يغني عن الأدوية. كثير مرضى هم كانوا very obese and diabetic after doing this bariatric surgery ما بعد يحتاجون حتى علاج يعني طابوا من السكري اللي هو احنا نقول المريض ما يطلب السكري، لكن عمل البارياتريك سيرجري ونزل وزنه ممكن انه يستغني حتى عن الادويه مال السكر. So it is usually reversed for those with severe obesity. المرضى اللي indicated in body mass index more than 40 kg اللي morbid obesity سمينا per meter square. Those with a body mass more than 35 kg اللي يعتبرناهم severe type but not morbid اللي هذول especially إذا كانوا type 2 diabetes مثل ما حكينا قبل شوية، أو إذا كان عنده severe obstructive sleep apnea ما يقدر ينام من الأوبستي يختنق، هذا قلنا يؤدي إلى بالمستقبل of hypertension of heart failure. فأيضا شافوا إنه they may be advised to do this surgery. Several approaches are used and all can performed by laparoscopy. فممكن تنعمل laparoscopically. مثل ما ذكرنا قبل شوية is very important that diabetes may improve rapidly after surgery, and particularly if the gastric gastric bypass type, and this may be attributed to severe energy restriction and also increased release of incretin hormone اللي هو يشبه يعني أمثلة عليه وهي الجلوكاجون لايك بيبتايد اللي قبل شوي حكينا عنه GLP-1 اللي هي أشقد تزيد أشقد تكون decrease the weight. And this may also improve glucose control because مثل ما قلنا راح يزيد الانسولين وتقلل الجلوكاجون اللي هو يرفع السكر. Laparoscopic bariatric surgical procedures including gastric banding, sleeve gastrectomy, RONY, gastric bypass, and duodenal switch. ما راح نناقشها هوني، راح ممكن بالجراحة بعدين تاخذوها بالصف الرابع. زين. The complication حال أي operation it may have complication. The mortality, there is some risk of mortality, even sudden death happens in some patients, but really it is low if it is done in well-experienced centers. The post-operative complication الشائعة لأي عملية may cause respiratory problem, may cause wound infection, dehiscence, stomal stenosis, marginal ulceration, deviant thrombosis. All of this is reported as a post-operative complication. Later stage complication, it may cause pouching or distal esophageal dilatation, and the patient may continue to have persistent vomiting or dumping, that's to feel discomfort of the abdomen after heavy meal, and also micronutrient deficiency, especially folate, B12 and iron. So we should pay attention to have a regular follow-up for those patients بعد ما يعمل bariatric surgery. دائما نفحص الفوليت والB12 والiron level ونفحص المريض إنه عنده أنيميا. Sometimes they have very difficult to treat anemia because of decreased intake and also decreased absorption of these important micronutrients. The last slide here, we need to treat other additional risk factors in المريض. So we are advise them to stop smoking, to stop alcohol consumption, and to treat their diabetes, to treat their hyperlipidemia and hypertension by drugs, and also to try to relieve their obstructive sleep apnea. خلصنا محاضرة الأوبستي. إذا عندكم أي استفسار أو سؤال. خلي بس أسجل الحضور. أكو أي استفسار أو سؤال؟